here.
74 countries now have been hit by the coronavirus, and the numbers are growing outside of China. Here's a look at where COVID-19 stands. Nearly 92,000 cases have been confirmed worldwide. More than 3,000 people have died. Here at home, 2 new cases in Ontario and 1 in BC today bring the total number in Canada to 30. The worst affected regions outside China continue to be Iran, South Korea, Italy, and Japan. Canada has issued some travel advisories for those areas, but should this country do more to contain the spread? And are Canadians getting all the information they need to prepare for a possible pandemic? Marie-France Lalonde is an Ontario Liberal MP. She joins me here in studio. Matt Genereux is the Conservatives' health critic. He joins us from Edmonton. Don Davies is the NDP's health critic. He joins us from Vancouver. Hello to all three of you. Thanks for being with us. I appreciate it. Ms. Lalonde, I'm going to start with you. And I'm actually just, before we get to the health aspect of us, I want to check in on the economy. We had Minister Bill Morneau on earlier, and I was asking him about the way in which the federal government might respond if, in fact, a global recession hits and Canada's economy is impacted negatively. And he said that the budget wouldn't necessarily be the place to find that response. And I'm wondering why not? Wouldn't the budget be the place that the government looks to address economic uncertainty?
Well, I would say what the minister is saying is basically as the situation is evolving and the impact is being assessed, we would have to respond. So our prime minister was very clear that if, cases are reported internationally and businesses might be affected, we may have to respond. But the response may be just in a way of helping businesses redirected their product or whatever the impact may be. So at this point...
So you're not looking at any kind of big fiscal stimulus?
Well, certainly as a local MP, I don't think it's my responsibility to say that, but I would say is our response as a government would be there for sure if the impact is so significant. Right now, we are monitoring the situation, and I'm very pleased to see that monitoring taking part.
Mr. Genereux, if the impact on the economy does grow, your party has been critical of the deficit that the government is running right now. Are you prepared to support adding to that deficit if it, in fact, addresses the economic impact of coronavirus?
Well, I think just the statement that Ms. Lalonde just said is lack of uncertainty of what really to expect from this government. You saw just in the last quarter a 0.4% growth rate, which was some of the lowest in the last 4 years, and we really don't have that much of a buffer to be able to provide a stimulus to the coronavirus at this point.
The government disagrees, right?
The minister can.
They say the debt. I just say they disagree. They say the debt to GDP is lower than other G7 countries. That justifies sort of spending more if they had to, and that gives them the room to do so. Your response? With
ballooning deficits, like we've seen, when's the budget going to be balanced? That's a question we keep asking. Again, 0.4%, 0.3%, and the lowest in the last 4 years is of growth in this country. It's those sorts of things don't give confidence that there is that buffer to be able to provide for something like the coronavirus. So, we'll see what the minister comes up with, but really at this point in time, and as Ms. Lalonde just said, there really doesn't seem to be much of a plan in place.
Mr. Davies, let me switch gears and ask you about the sort of response where health is concerned in this country. You heard the Prime Minister there say that the risk is still low. Is there more that you'd like to see from the government?
Yeah, I think so. There's been a real lack of detail being given by the government other than sort of broad general comments that they're monitoring the situation. I would like to see some more specifics. We've had 6 deaths in Washington state now. We're seeing other countries take more proactive actions than Canada is, and yet other than broad sort of platitudinous assurances, we really haven't had specific revelation of what the plans would be here in Canada. I'm glad to see that the frontline health professionals, the nurses, have been brought in by the Public Health Agency of Canada for consultation. That should have happened from the beginning. I think we just want to make sure that we have enough supplies and equipment. We want to make sure our hospitals and clinics have capacity. We want to make sure that there's sufficient diagnostics in Canada. And I haven't heard the government say anything about any of those primary issues, which I think we need to start hearing from them.
Let me quickly just play devil's advocate, Mr. Davies. The situation here versus other jurisdictions is different. We have 30 cases. Other countries have far more. The spread is obviously happening at a faster rate there. I'm not saying that nothing like that could happen here, but right now it isn't. Is the reaction from the federal government commensurate with the level of risk here?
Well, it's been very cautious, and I think it's important to be prudent and to also, I think, convey to Canadians a very evidence-based, cautious approach. We don't want to create panic. But the situation isn't that much different than countries like Greece or Australia. They have similar number of cases than us. Australia has a travel ban on travelers from China. Greece has canceled large events. I'm not suggesting we do that in Canada, but those are the kinds of steps that are being taken by other countries with very similar transmission rates to Canada. So I'm more, I think, concerned about the lack of details that I'm hearing from the government. I would like to hear what their plans are so that Canadians can be prepared, because it's that preparation that I think helps to assuage public concern and keep anxiety lower. Right now, we just have comments like from the health minister that we have to go stockpile, which has created pandemonium in the Costcos of the country. That's no way to conduct a government response to such an important public health event as this.
Ms. Lalonde, are there plans for the federal government to, like Mr. Davies says, be more explicit about what the plans are in the event things get worse? I take, the government's point on the level of the risk right now, but there is a big conversation happening internationally about the potential for this to be a pandemic. When will Canadians know exactly how your government plans to tackle that?
Actually, we are following what the World Health Organization is providing as to how to respond to this situation. As it's evolving rapidly, what you want is a government that's acting according to the evidence-based, working with our Public Health Agency of Canada that was actually created after SARS, and the learning that we've learned, we have been preparing. So when I used to work in a hospital, actually, and I certainly remember, situations. So every aspect where we've been is having conversation, educating Canadians, talking to them, reassuring them, but at the same time...
Yeah, with respect, I take your point. There's lots of talk about what to do to wash your hands, the actions that you can take. But in the event that things do get worse, are, for example, hospitals stocked with adequate amounts of equipment? We know that's a concern, for example, south of the border, right? Are there enough ventilators in Canada right now? Should they be required?
So from what we learned from SARS and the emergency preparedness plan that's been implemented, it's kind of the worst case scenario. So each health agencies, each local hospitals, under the guidance of Public Health of Canada, Ontario, and municipal leadership will all work together to ensure that if there's a certain area that is deeply affected, we would have the proper tool and the response to address the concerns that would be presented to us. I feel very confident, actually.
Mr. Jenner, do you feel as confident?
No, not at all, Vashti. I quite honestly, it's a lack of that plan that we keep asking the minister for, and I think Canadians are rightfully so asking the minister for. When she stands up and says that we need to stockpile food and medications, what does that mean? Does that mean we need to go and get a 6-month supply, a 12-month supply of medications?
She didn't say, to be fair, she didn't say run out right now and stockpile everything.
Exactly.
She was saying, I think what I remember hearing in the scrum was something along the lines of, as you normally would in the winter type of thing, store some stuff. I take your point.
She said, as you normally would in preparation for a pandemic. So I think those words are causing a lot of concern across the country. I know there's a pharmacy in my riding here in Edmonton that has run out of masks. People are flocking to the shelves we see in the States and selling out Costco. So really, what should we be prepared for? And by making the comments that Ms. Lalonde is saying that, well, we're monitoring the situation. Well, that's all fair and good, but if you're telling us to stockpile food and medication, then give us some sort of specifics. So should people stay home from work? Should they stay home from school? There's just so many unanswered questions.
I'll get you back in a second, Ms. Lalonde, but I want to get Mr. Davies in. Mr. Davies?
Well, I think we should turn to some positive proposals. One thing I'd like to see from the federal government is their answer to provide some sort of financial support for people who may find themselves having to self-quarantine. Many workers don't have coverage for that. We want to prepare, I think, for that contingency that we may be asking people to stay home voluntarily, not infect their coworkers at work if they don't have coverage. And I think we should, I'd like to see the federal finance minister working with the provinces to work on some sort of financial plan in that respect. I also think that it's time that the health minister did detail some plans about the supply of really important medical equipment like masks. I think someone said that they suggested that heads should roll at the Public Health Agency of Canada over their using a lower guideline for nurses where they were using surgical masks as a recommendation instead of the disposable respirators. And when they were asked why, they said it was because they were worried they would run out. Well, that speaks to perhaps a shortage of those. So I think we got to get productive and let's take an inventory, make sure that we're prepared, make sure that Canadians are well informed. And that's the best way to prepare for a pandemic should that ensue, which we hope it doesn't.
Unfortunately, I'm out of time. I have to go, but thank you. I know you want to